Well, thanks everyone for coming out today for this Fairness for All Canadians. We're with the people on my right here, and I think there's one hanging around somewhere. There's Kelly and there's Peggy. We're with the Northumberland Labour Council. My position is Political Action Chairperson with Northumberland Labour Council, but we're not here clearly to talk about Labour's voice, okay? We're here just to bring this forward for all Canadians, be very clear on that. This does involve all Canadians, our healthcare, and it's time enough that we brought our issues forward so we can get our messaging out. So I'm going to open it up with, she's not on the sheet for those who do have a sheet. Veronica Salaberry is president of the Northumberland Labour Council, so it's only fitting that she opens it up, and after that, Veronica, you can, I'll just introduce the candidate that people coming for, okay? Yep.
Good afternoon, everybody, and welcome for being here today. Actually, this is a very important issue we do have, and I would like to start saying that Canada has one of the most envied healthcare systems in the world, but access is a growing problem for many Canadians. We believe everyone should get the care when they need it. Historically, workers unlucky enough to get sick or injured at work were on their own. Many face financial wounds, and the accidents or illness they weren't available to work. Families drove themselves into bankruptcies paying doctor bills, but when they got sick and injured, wages earners continued to bring an income. For these reasons, workers were at the front line fighting for universal public health insurance and were instrumental in getting the Canada National Medical Program in 1966. Today we are facing different challenges in our healthcare system. Over 4 million Canadians don't have family doctors. Only 1 in 3 Canadians have mental issues, and actually only 1 of them receive this care. Over 3 million Canadians can afford the medications they do need. Also, we have a shortage of 86,000 long-term care beds for seniors over the next 10 years. So the federal government is cutting more than 36 billion from our healthcare systems. Too many Canadians are waiting too long for healthcare systems to treat as they need. There aren't enough nurses and healthcare professionals to meet the growing demand of the aging populations. Millions of Canadians don't have a family doctors, like we say. Healthcare workers are on the front line and see for themselves when it comes to fighting infectious diseases or epidemics. Many of us are struggling to find quality, long-term care for family members now, and worry there won't be enough room in the long-term facilities as we need it. And existing facilities don't provide enough care for our seniors. Together, we are calling to the federal government to reverse these cuts for more than 36 billion from our healthcare systems and to work with the province and territories on a new healthcare accord that will be expanded coverage and improve the access from all Canadians. Thank you.
Good work.
I would like to invite now Russ Christensen from the NDP for the Canadian Labour Council Progress.
Hello, Russ. Thank you.
Thank you.
Hi, everybody. Thanks for coming here today. It's kind of chilly, but it's a good day. Every day is a good day for demonstration.
Yes.
That's how I
Right
feel
on.
about it. Yeah.
Oh yeah.
Now, Mr. Norlock isn't here today, so he's not going to hear this, but I was just at his pre-budget consultation and some other people were there earlier as well. Rick has a bit of laryngitis, and at the pre-budget consultation I was mentioning this $36 billion in healthcare cuts over the next number of years.
Shame.
Because it is shameful.
Shame.
Absolutely.
Shame.
And we have an aging population. We need to put more money to take care of an aging population, people with dementia, other issues, long-term care, helping people stay in their homes, etc. So we need more money, not less. Now, I was talking about that idea, and then Rick said, well, we do have a socialized medical system? And he goes, yes, that's what we have.
Bullshit.
He did say it. Thank you.
Bullshit.
He did, and it's funny because he said he supports it. He said he supports it, but yet his government is not. And that, to me, is just disingenuine. Now, Rick Norlock may be an honest person, but for him to say that he supports socialized medicine when he can't even say the word
Yeah.
they're cutting $36 billion. I call that bullshit. That's what it is.
Yeah.
And I think we all need to be honest about that. And we all need to realize that as we all age, we're going to need to use the healthcare system more. And young people, we talked about youth unemployment today, which I think is a fundamental issue. Youth unemployment, that leads to people paying taxes, decent jobs. There's so much precarious employment. That's how we're going to support, through the taxes, our public systems, our public healthcare system, etc. And that's what we need to do. So I want to thank everyone for being here today, and let's just keep this struggle going, because we have to continue to put this issue on the table. The Conservatives and the Liberals aren't going to talk about supporting public health care. It's the NDP's #1 issue. We have to continue to talk about that, and thanks to the Northumberland Labour Council for doing this today.
Right on. Right on.
Can we ask a question? The health board dies. What's the mechanism to keep
The
this
mechanism is
on
going to have to be the election, because Harper's already said that the health accord is going to be dead, and they're only going to increase by the percentage increase of GDP, right?
Which drops all that funding.
Exactly. So the election in 2015 is what we have to focus on. And we have to elect a majority, or at least a minority NDP government. It's the first time in Canada's history we've had that opportunity as the official opposition. And Tom Mulcair is doing a great job as the leader.
Thank you.
Thank you, Russ.
Thank you.
Now we would like to introduce Peggy Smith and Kelly Walker to give our views of our healthcare housing today. So Peggy and I, we have been working on the Health Accord campaign. It's a campaign that's Canada-wide. It's put on with the Council of Canadians and CUPE as a joint campaign, and we started it last April. We did it for a few weeks, and then we were back again in August, and as we get closer to the 2015 election, we're going to ramp it up even more. So, in case anybody doesn't know, the Health Accord was the 10-year contract between the federal government and the provinces to fund public health care, and they have done $36 billion across Canada, but $14 billion alone in Ontario. We all know what that means. We can't afford to lose $14 billion. And so what we've been doing is we've had 26,000 pamphlets, we've knocked on doors all through Oshawa, canvassing the streets, and we're getting out there to let all the public know what the health accord is and why it's important to have our federal government to get back to the table and renew it. But not just renew it, we need it renewed adequately, fund it properly to keep our health care public.
Here, here.
Right on. Right on, Kelly. Right on.
I just want to remind everybody of the cuts that has happened in this community. When we first started out with our brand new hospital, we had outpatient physiotherapy, we had an outpatient diabetic clinic, we had a fast track in the ER, we had long-term care beds, and we had alternate level of care beds, and those are all gone. Canadians tend to have a short memory when it comes to elections. They go to the ballot and they don't cast the right votes, it would seem, because now we're looking at a huge deficit, even more than what we've got standing now. Hospitals are made accountable through the LHINs, as you all know, which is basically a scapegoat for the government because they don't want to admit that they want to cut hospital budgets. We have to have balanced budgets every year, and every year we look at layoffs and loss of services. So I just want to remind you all that this is a very important thing. I know they always say Peggy's on a rant, but if I don't rant, nobody knows.
Yeah.
So we have a box of pamphlets over there, and inside it has saveourhealthcare.ca. You can get any information you want, but also you can fill out, you put in your postal code, and it will go to Rick Norlock, and it's to ask them to stand up and fight for our healthcare, okay? And all over Canada, the same thing. Go onto that website and everybody can put their postal code in just to reach out to their...
We can't even fathom how $36 billion in healthcare cuts will affect us. They want to privatize clinics, which they're doing in Toronto now. colonoscopies and cataracts where people are paying not only OHIP fees, but above those fees as well. And now if we bring those into our community, our meat and potatoes are our cataracts and colonoscopy scopes for our surgeries. If they start privatizing clinics, we're going to be closing more and more services. So please pass this word to everybody. Thanks.
Yeah, the government keeps telling us that the answer to our healthcare problems is private. It's not the answer. Private is not good.
No.
We need to keep it public.
Universal health care.
Yeah, absolutely.
And not
Tommy
just for
Douglas
us,
fought for
our
that.
children and grandchildren in the future.
What happens if they, you know, the hundreds of thousands of people who can't afford to pay for colonoscopies, then they get colon cancer? It seems to me that costs the system a hell of a lot more.
Versus
Mitigate.
prevention.
Mitigate.
Yeah.
Prevention.
Absolutely.
Yes.
The government wants you to die, and then there's fewer of you to complain.
No, but it's paying for the treatment.
And the
meantime.
clinics don't have the supports that the local hospitals have if you have a medical
No.
emergency.
You know what they do in Peru?
during
They
your
put the
procedure.
funeral home right
Well, I
beside.
can tell you
Yeah, I should tell you.
a
In
short
Peru,
story.
they do a privatization.
I know
What
this is
happens to
personal
Joan
for me.
Rivers in a private clinic?
Benefits. Okay, that's actually something happened to me. My father was a lieutenant of the police force, and he got ill. He passed away 2012. And you know, because of the government, he had his health care, but he was out of the country, out of the province, sorry. And it was sad because when I went there, you have to buy for everything. It was privatization, like you say. You have to buy from pillows to the bed where he's gonna be, to gloves, to gowns, to the doctors. You have to provide everything. It was 2 chefs during the day, 12-hour shift by the doctors, and you were given a list every 12 hours, which you have to provide immediately. If you were not to have that, your family would be dead. So it was from medication to needles, everything, from ambulance to blood tests to urine tests, everything was done out of it. It was all you have to pay separately of the hospital. Anyways, it is one of the worst things I have ever lived. And stress as a family member, you know, not knowing that your family is going to survive or die. When you were outside, you have different pharmacies. Every pharmacist have a medication which will cost certain amount of money, but because they didn't run out, the next one will be double or triple. As you went in, your prices were going up. Since people can afford that, then you have on the other side of the streets, which were all funeral homes, and you were given a packet to choose what do you prefer for your family. So that's where we're heading. This is a very important issue, and we have to put a stop right now before it gets there. And I think what we have, it is good. We have to maintain it that way, and we cannot let our healthcare goes that way because it's not. Until you don't live those things, and I have lived through, and I could afford it then, but people down there, they just die. 1 minute you go, and next minute you know they're going to the funeral.
It's like the Joni Mitchell song, you don't know what you got till it's gone, right?
Yeah,
So
yeah,
that's, we
can't
have to
that
keep it.
in here. No, certainly. We have to fight for this. So, sorry. We can go in with the next. Thank you, Carolyn, Peggy. The next will be Paula Fillion.
Yeah.
From the Northumberland Coalition Against Murder.
Okay, Deb had asked me to speak today about the actual cost to people already living in poverty, the healthcare cuts we've already experienced, and the healthcare cuts we have yet to experience. Currently, if we lose our healthcare and go to privatization, people who already cannot afford things like physiotherapy and diabetes clinics, where they get moved away, are going to be less likely. They are going to get sicker. They're going to be a bigger burden on the healthcare system that already can't afford it. There are going to be service charges. People are going to have to decide what they're going to have to give up in order to pay those service charges when there is nowhere to take the money from in the first place. You're going to have people who are already on the verge of becoming homeless. And then once that's happened to them, the healthcare system has failed them, and they'll never get back in. In my own home, my husband was not well. For 22 years, he was not well. And we watched service after service being cut, more and more that we couldn't access. We spent the last 17 months searching for a new psychiatrist that would treat him within driving distance to us. 2.5 weeks before his first appointment, he died. And I believe that he died as a direct result of the fact that we could not access what we needed in time to save his life. This is happening every day already, and it will continue to happen, only in multiples of amounts that we can't even fathom, tens, hundreds, thousands. And in the meantime, the hospital will be full of all the people that have the money to afford the care that they need. And this is something that we simply cannot tolerate. This is something that we have to fight for. It's been fought for in the past, and we have to fight to keep it.
Okay, we're just, unless anybody else wants to come forward and make a couple comments, anybody? It's open forum.
I'll complain about the local hospital. When they made the cuts to the physiotherapy and the specialized diabetes clinics, and there was a fuss being made about it. And the hospital administration, we all remember him, I'm sure, Robert Byron, he acknowledged that these cuts would have a disproportionate effect on low-income people in the area. And to me, that just added insult to injury, because we all know that one of the biggest indicators of health in Canada is your income level. So if you're poor, you're already at risk, and the hospital blithely goes along, oh, well, we know this is going to hurt the poor, but what can we do? And it seems to be perfectly all right. That's what really scares me. I think that we're really getting into a two-tier thing here with poor people at the bottom. They're treated like garbage wherever they go, and it doesn't seem to matter whether they get what they need or not. This is just another symptom of that whole sickening attitude that's more and more prevalent.
Well,
I'm
go ahead.
going to sound a bit cynical, but you know, I don't believe from what I've seen of the Harper government, they're not going to do a damn thing. They really don't care what we think. I mean, if you don't have money and
Here you go.
they just don't care.
So like
So
Monopoly.
what I'm saying is, I think we should put all our efforts into getting rid of that Harper government.
High five. I'll give you the high five.
Right.
That lady spoke well on that one, right? The only way to get rid of it is to make change. And Russ mentioned about when change occurs, right? It occurs in 2015. I don't know the exact date, but see fall
October
time.
19th.
Couldn't be sooner
You
for me.
think it's something, that's the earliest.
That's the fixed election date.
Fixed election day.
I want to just say this as political action chairperson, and I thank everyone for coming out today. I know it's not the best and it's nice and warm, but this Conservative government is cold-hearted, and it's cold outside, so we might tie the two together. Cold-hearted and cold, but phone Rick Norlock's office up. Phone the health minister up. You want the health accord renewed. You want universal health care and the standard of care across Canada. That's the same for all Canadians. And, once again, just because we're Labour, the only reason just we're organized at point of view. We're not here to give Labour's voice. This is a voice for all Canadians. And we've talked about it. We're going to have an open forum. Look for it. It'll be about the second or third Saturday in January. It'll be warmer and indoors. It'll be at hopefully a library or the Carpenter's Hall in Port Hope. But we will send out notice. We hope to see you there. We hope to have more people in. You need to get your family and friends involved. My wife too often tells me to shut up sometimes at home. She's had enough of hearing from me. Well, guess what? I live, eat, and sleep it for trying to make Canada a better place to live. It should be the same for all, for the poor, for the middle class, for the rich. Everyone should get equal treatment amongst us all. I don't think anybody here disagrees with that.
No.
Right?
Of course
We're not disagreeing. So talk to your family, friends, and get them out here at the next one. It's very important not to give up. Don't ever give up. Don't let them tell you it can't be done. I think you used that line the other day there, right?
Exactly.
Don't let them tell you, don't give up. That's what they want you to do, is give up, right? Don't give up, right? We're not going to give up, right?
No.
No.
Right,
Right
don't give
on.
up, right on, don't give up, right? Anyways, I want to thank everyone for coming out today. I know it's not Norm. Like I said, I appreciate the
That's
speakers.
Canada. We're good.
That's right. Hey, Canada, hey, Canada, eh? Well, thanks very much, and I look forward to seeing you all at the second or third Saturday in a warmer spot. So look for the notices coming out, and thank you very much.
Thanks for organizing.
Thank you.
Thanks, Chris.
No, thank you.